guys, I did my paper on the case of Inri Cassandra C, which is based on the decisional capacity of a minor. So for some background, Cassandra is diagnosed with Hodgkin's lymphoma, but in the beginning of her diagnosis, her mother caused her to miss many important diagnostic appointments, and this caused the physicians to be concerned, and they ended up bringing the case to the state and reported her mother for neglect. So this caused Cassandra to briefly be taken out of the custody of her mother, but a couple days later she is then placed back in her custody when she agrees to receive chemotherapy. Cassandra then goes through one treatment of chemotherapy, and the morning before her second treatment, she runs away and is later found at a friend's house that day, stating that she does not want to receive chemotherapy anymore. Her and her mother then fight the state to accept the mature minor doctrine that would allow Cassandra to make her own medical decisions so she can refuse chemotherapy. This occurred from September 2014 to January 2015, and throughout this whole case, Cassandra's stage of cancer was quickly escalating and was getting worse, so treatment was more important by the end of the trial. So the stakeholders are Cassandra and her mother and the state of Connecticut. So Cassandra and her mother wish for Cassandra to make her own medical decisions so she can withhold chemotherapy, but the state of Connecticut has an interest in Cassandra receiving the treatment because it will overall benefit her future health in the future. So for significance of this topic, just to put everything into perspective, 1 out of 285 children will be diagnosed with cancer before the age of 20 in the US. So this is 15,700 new cases a year, and 20% of the children with the cancer will not survive it, and every 3 minutes a child is diagnosed with cancer. So these pediatric patients, when they're diagnosed, they deal with an abundance of new information, and it can be very overwhelming for them depending on their age and their development. So it's really easy for them not to understand anything since they're so young. And many of them, like Cassandra, do not want to go through chemotherapy because they only see the bad notion of it when they're going through it and what they'll look like when they're going through it, but they won't know how they will be in the future and how it will benefit them. My thesis statement is, although autonomy is an important factor for patients receiving healthcare, physicians are obligated to intervene and push for necessary life-saving treatment for the overall health and future of a minor. The ethical principles in conflict are beneficence, utility, and autonomy. Beneficence and utility pretty much go together and they oppose autonomy. So if autonomy is met, then beneficence and utility will not be, and vice versa. If beneficence and utility are met, autonomy will not be met. So autonomy is the right to self-government. So Cassandra does not want to receive chemotherapy and she wants her autonomy granted. So if the treatment is forced on her by the court, she will lose her autonomy. Beneficence, the right for the physician to provide exceptional care and provide treatment to benefit the patient. So the physicians are adamant about the chemotherapy treatment for Cassandra because of the high chance of survival at 85%, and this will ultimately benefit her and give her a normal life in the future. The last one is utility, so an action is seen as good or right if more people benefit from the action than suffer from it. So Cassandra is seen as part of the future generation and will become a productive citizen in the future if she receives this treatment. But ultimately, if she does not receive this treatment, she will die within the next 1 to 2 years. So her receiving this treatment will benefit more people than her not receiving it. So for laws, codes, and duties relevant to this case, the mature minor doctrine is the biggest one in this case, and it allows minors who demonstrate a sufficient level of maturity to be able to make their own medical decisions independent of third parties. So with this, in the case, Cassandra and her mother fight for the mature minor doctrine to be accepted so she can make her own medical decisions and refuse chemotherapy. And then there's the obligation to report possible neglect. So all states require healthcare providers, teachers, and other licensed professionals to report suspected child abuse to the authorities. So this is what the physicians did when Cassandra's mother was not bringing her to the important diagnostic appointments that would determine her treatment. So they decided to bring the case to the court and file her for neglect. So again, the codes that are relevant in this case are beneficence, autonomy, and utility. So beneficence is in the interest of the state and the physicians, and it will allow the physicians to provide her with life-saving treatment. Autonomy is in the interest of Cassandra and her mother because they want to push the state to allow Cassandra to make her own medical decisions so she can refuse the treatment. And utility is in the interest of the state because the treatment will allow Cassandra to live a normal life as a productive citizen in the future, and the treatment will benefit the most people. And again, not all of these codes will be met in this case. The legal outcome of this case was that the court decided to deem Cassandra as immature and not able to make her own medical decisions. I personally agree with the decisions of the court because Cassandra did not understand or could not comprehend the information given to her and couldn't comprehend the degree of her cancer and how late of a stage it was. Her likelihood of survival with this treatment is also 85%, so it's very high and it's very likely that she would be able to live a normal life in the future. And if she were to refuse the chemotherapy treatment, it's almost a guaranteed death within the next 1 to 2 years. So overall, it is good that the court decided to end up deeming Cassandra as immature because if they allowed her to make her own medical decisions, then she would not have received the chemotherapy and it would be a guaranteed death for her in the next 2 years. So a proposed solution for the future would be to have a set guideline where if the chance of survival in a pediatric patient with treatment is above 80%, autonomy can immediately be overruled when the outcome with no treatment for the minor is guaranteed death. However, unless there are religious or cultural reasons where they cannot receive the treatment that would guarantee them 80% chance of life, this solution would not apply to this case. So in conclusion, pediatric patients understanding their medical treatments and illnesses is very important. Before they're able to make their own medical decisions, they must understand the aspects for their illness and the possible treatments fully. So Cassandra did not fully understand and could not comprehend the severity of her illness and the importance of the chemotherapy treatment, which is why this case arose in the first place and why the court deemed her as immature and unfit to make her own medical decisions. So to recap, even though autonomy is important in medical decision-making, physicians may need to intervene to help determine what is best for the patient when they need necessary treatment to survive.